All right, everyone. So you know who this is. You know what I'm here to do. But if you accidentally fell in this class, just as a reminder, I'm Teacher Fear, and we are here for another advanced class. I believe the intermediate level students will also be able to understand it. So there's that. And today I bring you an analysis of an article from a newspaper from the New York Times about the pharmaceutical industry. The pharmaceutical industry. You know what I'm referring to when I say the pharmaceutical industry? I'm going to share the screen now. We are going to read the whole thing, the whole text. I'm going to highlight some of the words and expressions that I believe stand out from the text. Okay. And after, we're going to answer some questions to check your comprehension of everything that we have read together. All right. So, first of all, let me share the screen here. So, what we have here is an article from the New York Times, like I said before, about the pharmaceutical industry. Now, I'm gonna write here beside the text some words that I believe stand out, some words that I believe are important, right? And you guys might want to take notes. Don't forget, guys, okay, that it's very important to be taking notes during these classes because that is part of the learning process, right? So make sure that you are taking notes. I'm not gonna send you what I write here because, of course, you can always pause the video, but I'm not gonna send you any extra material because the idea is really that you also do your part, right? So first of all, the general topic is the pharmaceutical industry. First of all, notice the way I pronounce pharmaceutical, right? Pharmaceutical, something like this. Pharmaceutical, the pharmaceutical industry. We know we know what I'm talking about when I say that, right? I'm referring to all of those big industries, those big companies like Purdue, the one that we're going to read about here, but also like AstraZeneca or Pfizer. All of those are companies that belong to the pharmaceutical industry. So this is an article about drug abuse. I gotta say, it's a sad story, and but I believe it's going to be really interesting, especially for my students that are involved with health. You know, my medical students. I mean, you are medical students, but you are medical students that are my students as well. So the people that work with health, or the people that work or that have worked with law before, also going to be pretty useful for you. So I'm going to do the reading, and once again, just like we did last class, I challenge you, let's say, to read each paragraph. And after you do it, you can read along with me and check if what you thought was the pronunciation of each word here is the actual pronunciation of this word, right? So let's read together, let's read along, but you start before me, and then you check if you're pronouncing every word correctly, all right? So this is from Washington. Purdue Pharma pleaded guilty pleaded guilty on Tuesday to criminal charges that it misled the federal government about sales of its blockbuster painkiller OxyContin, the prescription opioid that helped fuel a national addiction crisis. The admission brought a formal end to an extensive federal investigation that led to a multi-billion-dollar settlement between the company and the Justice Department. So we have many interesting things here, right? First of all, Purdue Pharma pleaded. Let me let me change something here because this is not looking good. I'm gonna use the straight line. Pleaded guilty or pleaded guilty. When you plead guilty, you are in a legal suit, right? A legal lawsuit, and you say, I'm guilty, Your Honor. You're talking to the judge, right? And you say, I'm guilty. So we use the verb to plead, right? They pleaded guilty to something, right? In their case, to criminal charges that it misled the federal government. This comes, of course, from the verb to mislead in the present, right? And to mislead is a synonym of to fool someone, for example. A synonym of to fool. You are making someone believe that something is true, right? While when it's not. So it misled the federal government about sales of its blockbuster painkiller OxyContin. This drug, this painkiller, right? A painkiller, a drug, a medication that keeps you from feeling pain, right? That ends your pain, or at least that mitigates your pain. So this drug helped fuel a crisis. Fuel a crisis. So the word fuel can be a noun, right? Oil, for example, is a kind of fuel. But when it's a verb, we are saying that it helped to instigate this crisis, right? It helped to make this crisis worse than it already was. That's the point. What else do we have here? A settlement. A settlement in the legal context means an agreement, right? So they agreed that the lawsuit would end after, there was an agreement that this lawsuit would end, but Purdue Pharma would have to pay many billions of dollars, I guess. This was the settlement. This was the agreement, right? And when part of the agreement was they had to plead guilty. They had to plead guilty. Let's see here the quotations, right? So, first of all, the abuse and diversion of prescription opioids has contributed to a national tragedy of addiction and deaths, Jeffrey A. Rosen, the Deputy Attorney General, said in a statement. Today's convictions underscore the department's commitment to its multi-pronged strategy for defeating the opioid crisis. So, these opioids were being prescribed, right? And this guy, who is the Deputy Attorney General. The Attorney General, this is a position in US politics, which is a person that represents the government when the government needs to sue someone, right? When the government needs to start legal action against someone. And he is the deputy. Deputy, when in this context, is like the vice or sub attorney general. So not the main attorney, but part of the attorney general's crew, part of his team. And when he says that the convictions underscore the department's strategy, he's saying that these convictions highlight, they show that the department was really committed, was really dedicated to their strategy. Now, what is a multi-pronged strategy? A multi-pronged strategy is a strategy that has different initiatives inside it. A prong, think of a fork, okay? Imagine a fork. I'm talking about the thing that you use to eat, a fork. A fork has usually 3 prongs. So 3 points, 3 pointed parts. Each of them is a prong. So when a strategy is multi-pronged, we are saying that this strategy has different divisions inside it, right? And that was something that the department, right, was the Justice Department in the US was dedicated to doing. Let's keep reading. Now we're going to see the perspective of the chairman of this company. The chairman is like the CEO, right? So Purdue's chairman, Steve Miller, acknowledged in a remotely conducted hearing in federal court in New Jersey that in order to meet sales goals, the company told the Drug Enforcement Administration that it had created a program to prevent OxyContin from being sold on the black market, even though it was marketing the drug to more than 100 doctors suspected of illegally prescribing OxyContin. So that was a lot of misleading, right? The chairman of the company, the CEO, acknowledged. This is the verb to acknowledge. To acknowledge. Which means to admit that something is true. He acknowledged in a hearing, which is what a procedure that happens when the court, when the judge is hearing you, this is why the name is a hearing, that they told the DEA, right, the Drug Enforcement Administration, this is the American government organ responsible for taking care of everything related to drugs, legal and illegal drugs. He said that they created this program to prevent the medication from being sold, but they marketed the drug, so they sold the drug, basically, right, to more than 100 doctors that were prescribing this drug illegally. So, horrible story, right? Horrible story, but they were probably making a lot of money, right? So, let's keep going. Purdue also pleaded guilty to paying illegal kickbacks to doctors who prescribed OxyContin and to an electronic health records company, Practice Fusion, for targeting physicians with alerts that were intended to increase opioid prescriptions. Practice Fusion has paid $145 million in fines for taking those kickbacks in fines. So, what happened here? They pleaded guilty to more things. They admitted that they were guilty of more things. First, paying illegal kickbacks. What is a kickback? A kickback is when you give money to someone for something, for example, you are driving on the road and the police stops you and you are doing something that you shouldn't be doing. For example, you are driving over the speed limit. In some situations, in some countries, maybe the police will ask you for a kickback, for money to release you. So this is a kickback. And apparently Purdue was paying doctors to prescribe OxyContin, giving them money to do that. And also to this electronic health records company, a company that keeps records, registers, files of patients, right? Oh, and this company, the Electronic Health Records Company, they paid $140 million in fines. What is a fine? Is it's money that you have to pay for the government, for some official authority, but in this case, it's not illegal. You have to pay it because you did something bad. That's a fine. That's a fine. Very common in traffic. For example, when you are driving, if you drive over the speed limit and people see you, you will probably need to pay a fine. Not to run away from not to run away from what you did, but to pay for it, right? You need to answer for it. So a fine is a legal money that you have to give the government because of something bad that you did, right? OxyContin was introduced to the market in the mid-1990s as a miraculous, non-addictive painkiller. That was inaccurate, and as more doctors prescribed it, people across the country became addicted to the drug. The increase in demand created a booming market for unlawful prescriptions and pharmacies that were no more than fronts for OxyContin sales, which also helped to fuel a larger scourge of addictions to illegal opioids like heroin and illicitly obtained fentanyl. So there are more drugs involved, right? First of all, a miraculous, non-addictive painkiller, right? So they said that this drug was non-addictive, non-addictive. So couldn't get people addicted to it. But that was inaccurate. inaccurate, which just means not true, right? Not true. It's not the reality, right? Um, this created a booming market. The increase in the demand created a booming market for unlawful prescriptions. So, unlawful, a literal synonym of illegal. They basically mean the same thing. And all of this process helped to fuel a larger scourge of addictions. Now, it's a little hard to define a scourge, but a scourge basically means something very bad that happens, something very bad that happens. It's like a plague, something horrible, something horrible. Just going to the last paragraph here, the federal settlement does not end all of the litigations that Purdue faces, nor will it end the continuing investigations and lawsuits related to other drug makers and distributors accused of fueling the opioid addiction crisis. So the federal settlement, the agreement, the deal that Purdue and the Department of Justice reached doesn't end the litigation, doesn't end all the legal process. This was just one suit, right? One lawsuit. And apparently they're going to continue investigating, right? So that was it, people. If there is any other word that you don't know here and you want to bring it to me so I can explain what it means in our regular classes, in our live classes, please do it. It will be a pleasure to help you, of course, it always is. And as you could see, how would you summarize this article? So imagine you have to tell me, if you can write it down, that would be amazing. How would you summarize this article? What is the article about? What does the article say? It would be really interesting if all of you guys who are watching this class could summarize, maybe in a short paragraph, what this story is about. Okay, that's my challenge. Now, let's move on to some questions. So we have some multiple choice questions here, and I want to know if you guys can get it. I'm going to read it. I'm going to read the answers, and then if you guys want to stop the video, think about it, maybe go back to the text, okay? You can go back to the text and check if you remember the story correctly, and then I'm going to give you the answers, all right? So, the first question is, once again, I challenge you guys to read it before me to check your pronunciation, okay? And then you can hear me reading it. So, first of all, what criminal charges did Purdue Pharma plead guilty to? Letter A, misleading investors about the company's financial status. Letter B, violating environmental regulations in their manufacturing plants. And letter C, misleading the federal government about sales of OxyContin. What do you guys think? If you want to pause the video, if you want to go back to the text to check, the answer is, of course, letter A. I'm just kidding. I was just checking if you were paying attention. The answer is, of course, the letter C. But misleading the federal government about sales of OxyContin. That's the point, right? Let's check the second question. Which prescription opioid was at the center of the national addiction crisis? And how did it contribute to the crisis? Notice how we ask this question here, right? How did it contribute? That's the meaning here, right? Como contribuiu? Letter A, codeine, due to its widespread availability in over-the-counter medications. Letter B, OxyContin, due to its non-addictive properties as initially claimed. Letter C, morphine, due to its controlled and regulated distribution. If you want to pause the video, check the text again. The answer is, of course, OxyContin. Now, I want to clarify some things. What is an over-the-counter medication? The counter is the space where people can place their hands in a pharmacy, in a drugstore, And a lot of times we see that space, that physical space, and there are some medications there that are accessible for anyone to just take it, like they can reach it with their hands and take it. Painkillers, medicines for the flu, for example. This is over-the-counter medication. This is the kind of medication that you can find over the counter, right? Or sometimes inside it, right? But that's the idea. Those medications that you don't need a prescription for, okay? That's the idea. Let's move forward. Sorry, I'm gonna have to cough here, but I don't want to pause the video, so please, you guys don't. I hope you don't mind. Number 3. What was Purdue Pharma's claim to the Drug Enforcement Administration, the DEA, despite the reality of their actions? Letter A. Purdue claimed that they never marketed OxyContin to doctors. Letter B. Purdue claimed that they had no knowledge of the opioid addiction crisis. Letter C. Purdue claimed to have created a program to prevent OxyContin from being sold on the black market while marketing to suspicious doctors. What do you guys think? Think about it for a while. I'll give you the answer. It is letter C once again. They said that they did one thing, right? But they actually did the other. They actually did the other. Well, maybe we could say that they did do the first two as well. But of course, the most complete answer here is letter C. Let's move on. Number 4. What did Purdue Pharma do to meet sales goals, even though it was marketing the drug to suspicious doctors? Let's check the options. Letter A. Purdue reduced the production of OxyContin to create an artificial scarcity. Letter B. Purdue focused on promoting OxyContin only to legitimate pain specialists. And letter C. Purdue told the DEA that they had a program to prevent black market sales while marketing to suspicious doctors. So what do you think about it? What did they do to meet sales goals? If you want to pause the video once again, and I will tell you the answer in a second. So, what they did was, once again, letter C. They never focused on promoting it only to legitimate pain specialists, right? They actually told the DEA that they had this program, but they were marketing. In this case, I know that you guys might notice that it's a very similar answer to the previous one, but in this case, we're focusing on the marketing. They were marketing to suspicious doctors. Do you guys remember how many? Over 100 suspicious doctors. Let's go back to it. Where is it? Over 100 doctors. Because of course, that is a great way to meet sales goals. Oh, this expression, I think it's also useful to point. You meet the goals. Okay, this is a collocation. It's actually pretty an important collocation that you guys might wanna add to your dictionary, to your notebook. Meet the goals. That's when you sell as much as you have committed yourself to selling, right? But going back here, let's move on to number 5. What were the 2 illegal kickbacks that Purdue Pharma pleaded guilty to? So, letter A, kickbacks to law enforcement agencies like the DEA and hospitals. Letter B, kickbacks to electronic health record companies and pharmacies. Letter C, kickbacks to doctors and an electronic health records company. Which one do you think is right? You guys might want to take a pause here, think about it. It is letter C. Okay, when I was editing these questions, I should have changed the order a little because I'm noticing that it's gotten a little too easy. But the point here is, of course, to practice our pronunciation skills and increase your vocabulary knowledge. So that's fine. But too many C's It's starting to sound like our strategy at Enem, you know? If you're not sure, just choose letter C because it's C of certo, right? But anyway, yeah, the kickbacks were to doctors and the electronic health records company. Let's check here number six. How was OxyContin initially marketed when it was introduced to the market in the mid 1990s? And why was this portrayal misleading? Let's check letter A. OxyContin was marketed as an addictive painkiller, which turned out to be true. We wish, right? We wish, but not the case, definitely. Letter B. OxyContin was marketed as a non addictive painkiller, which was inaccurate. In letter C, OxyContin was marketed as a recreational drug, which was misleading. What is the answer? Think about it, and I will let you know right now. I hope you have paused if you're not sure. The answer is letter B, a non-addictive painkiller, which was inaccurate. We even had that discussion a few minutes ago, right, about non-addictive. Well, to be fair, it wasn't a discussion. I was talking to myself. But I hope there's someone on the other side of the screen right now listening, maybe laughing, you know. So, letter B, a non-addictive painkiller. And the last question here for today, what negative consequences arose as a result of the increase in OxyContin prescriptions across the country? Here we have arose, the past of the verb to arise, which is a synonym of to appear, no, and to grow when you're not expecting it. So what were the negative consequences that appeared, that showed up as a result of this increase in prescriptions? Letter A, the decrease in demand for illegal opioids like heroin and fentanyl. Letter B, a reduction in the number of people seeking treatment for opioid addiction. If you don't know, to seek is a more formal verb for the phrasal verb to look for. Seek, a synonym of looking for. And letter C, a booming market for unlawful prescriptions and pharmacies, fueling addictions to illegal opioids. This one might be a little more subtle, a little more subtle because letter C, for example, is also correct. However, we know that the negative consequences that were mentioned as consequences, not just as something that was also happening, was the booming market for unlawful prescriptions, right? So there wasn't a decrease in the demand for illegal opioids, there was an increase, right? And of course, heroin and fentanyl are mentioned, but they had a booming market. And they are other examples of illegal opioids. But the demand didn't decrease. Decrease means going down. It increased. It went up, right? So that's the point here. All right, guys, that was another advanced class that I also think intermediate students will probably be able to understand. I understand that there might be new words for you, and I encourage you to take notes on these words. Go back to the beginning of the video, check if you understood everything from the text, and bring whatever doubts or questions you have to our live classes. All right? It's been a pleasure. I'm still getting used to this talking to the camera for so long with no one listening to me, but I'm sure I'll get better at it with time. Let's just give it time. But as I said before, we're gonna have these classes every week, and this was this week's class. Thank you for your presence. I hope you appreciate the video, and see you soon.